In your Health Watch, healthcare providers and advocacy groups are calling for a change at the State House. It's all happening as groups are celebrating Reproductive Health Advocacy Day. Supporters of reproductive health care speaking at a news conference earlier today. Bralise Pimentel was there. She joins us now. Bralise, so what are they saying here?
Friendy, supporters filled the State House this afternoon to urge lawmakers to reconsider legislation they say could dramatically impact access to reproductive health care in this state. They say this state is in a health care crisis and the focus needs to change from what women do with their bodies. Dozens of healthcare providers, advocacy groups, and community leaders from across the state standing up for women's reproductive rights this afternoon. All of them pushing back against over 30 bills introduced at the State House that would restrict access to reproductive health care. Those bills essentially restrict access to medications used in abortion care and criminalizing pregnancy outcomes. Senator Margie Bright Matthews says this is an agenda introduced by the Republican Party and that needs change.
They don't really care about reproductive rights. They don't care about women. They care about control. I am sick and tired. It's exhausting for women to have to come up here to beg legislators not to kill them. It's exhausting and shameful that Senator Devine and myself have to remind them to stay from under my dress.
WACH Fox reached out to the South Carolina Republican Party for their stance on reproductive health. Chairman Drew McKissick released a statement saying, quote, South Carolina is a solid pro-life state and the South Carolina Republican Party is a pro-life party. That's one of the big reasons why Republicans have continued to make gains at the ballot box in our state. We represent South Carolinians on the life issue and Democrats don't. The debate over reproductive health continues at the State House with dozens of proposals still under consideration. Both sides say the conversation is far from over. Back to you, Friendy.